Pneumonia is often mistaken as a common respiratory ailment, but bacterial pneumonia is a condition that demands immediate attention and understanding. Its potential to swiftly escalate from mild discomfort to life-threatening complications makes it a silent predator in the world of infectious diseases. Every year, millions of people worldwide are affected, with infants, older adults, and those with underlying health conditions being particularly vulnerable. What makes bacterial pneumonia so dangerous is not just the infection itself, but its ability to spread silently and its devastating impact on those already weakened by other health issues. At its core, bacterial pneumonia inflames the lungs' air sacs, causing them to fill with fluid, pus, and cellular debris. This inflammatory process can impair oxygen exchange, depriving the body of the oxygen it needs to function. While some cases are mild and resolve with prompt treatment, others can overwhelm the body's defenses, leading to severe outcomes, including organ failure and death. Before diving deeper into the intricacies of bacterial pneumonia, we invite you to take a moment to support our mission to spread medical knowledge. Subscribe to our YouTube channel Dr. Mai, sharing medical knowledge, for more in-depth content on health and wellness. Don't forget to like and comment on our videos to let us know what topics you'd like to see next. The symptoms of bacterial pneumonia often present a stark contrast between mild discomfort and severe illness. A persistent cough, often producing thick yellow, green, or blood-tinged mucus, is one of the most common indicators, coupled with stabbing chest pain that worsens during coughing or breathing, sudden chills severe enough to make you shake, and a high fever. These symptoms paint a picture of an aggressive infection. Other symptoms might include headaches, muscle pain, breathlessness, severe fatigue, and pale, moist skin. In older adults, bacterial pneumonia can manifest differently, with confusion and dizziness being hallmark signs. For children, the signs can be even more distressing, including flaring nostrils, chest retractions, or bluish lips and nails, all pointing to insufficient oxygen levels. These symptoms are not just warning signs, they are red flags demanding immediate medical intervention. Bacterial pneumonia is often caused by bacteria entering the lungs, either through inhalation of respiratory droplets or migration through the bloodstream, while Streptococcus pneumoniae is the leading culprit. Other bacteria, such as Haemophilus influenza and Staphylococcus aureus, can also trigger the disease. Community-acquired pneumonia occurs outside healthcare settings, while hospital-acquired pneumonia, a more antibiotic-resistant form, develops in medical environments. The latter poses significant challenges due to its resistance to standard treatments. Those with weakened immune systems, chronic respiratory conditions, or recovering from surgery are at heightened risk. Environmental factors, such as smoking and pollution, further exacerbate susceptibility. It's essential to recognize that bacterial pneumonia often piggybacks on other illnesses, such as the flu, turning a mild viral infection into a severe bacterial one. Timely and accurate diagnosis is crucial in managing bacterial pneumonia effectively. Physicians often begin with a physical examination, listening for abnormal chest sounds indicative of fluid buildup. Further diagnostic steps include blood tests to assess infection severity, blood cultures to identify bacteria, sputum cultures to pinpoint the infectious agent, and chest X-rays to visualize the extent of lung involvement. In some cases, advanced imaging or tests may be necessary to rule out complications or other conditions. Treatment for bacterial pneumonia varies depending on its severity. For mild cases, oral antibiotics and supportive care, including rest and hydration, are often sufficient. However, severe cases require hospitalization, especially for young children. Older adults, and those with pre-existing health conditions, hospital care typically involves intravenous antibiotics, oxygen therapy, and fluids to prevent dehydration. Respiratory therapy may also be necessary to support breathing. Despite the availability of effective antibiotics, Delayed treatment can lead to complications such as pleural effusion, lung abscesses, or even organ failure. This highlights the importance of seeking medical care at the earliest signs of the disease. Preventing bacterial pneumonia begins with good hygiene practices, such as frequent hand washing and covering your mouth when coughing or sneezing. Vaccinations, particularly the pneumococcal vaccine, offer significant protection against Streptococcus pneumoniae. The Centers for Disease Control and Prevention recommend these vaccines for infants, young children, and adults aged 65 and older. Additionally, managing chronic conditions, quitting smoking, and avoiding pollutants can reduce your risk. For those recovering from illnesses or surgeries, following medical advice to bolster the immune system is critical. Maintaining a healthy lifestyle, including proper nutrition, regular exercise, and adequate sleep, can also strengthen the body's defenses against infections. Bacterial pneumonia is more than an individual health issue. It is a public health concern with widespread implications. Its ability to spread silently and its devastating effects on vulnerable populations make it a formidable adversary. However, with early diagnosis, effective treatment, and proactive prevention measures, we can significantly reduce its impact. As you reflect on the seriousness of bacterial pneumonia, remember that knowledge is power. Equip yourself and your loved ones with the information needed to recognize symptoms. Seek timely treatment and take preventive measures. And if you found this article informative, consider sharing it with others to spread awareness. Visit Dr. My Sharing Medical Knowledge on YouTube for more valuable insights. Don't forget to like, comment, and subscribe to support our mission of empowering individuals with the knowledge to lead healthier lives.